So able to see my slides. With that, we start today's 27th webinar on 25th of July. And the topic for today's webinar is multi-channel marketing for MedTech and Health OTC brands. Yeah. So coming to me, good afternoon, and thank you for joining in. I'm Ashish Jain, founder and CEO of Medgini. I started Medgini in 2012 with a simple vision of helping pharma companies to connect with chemists, doctors, patients with the help of technology. And today I'm proud that we have built up a profitable organization, and we work with leading healthcare brands of India. I've done my MBA from Symbiosis Institute of Business Management in 2004 and had the opportunity of working across IT, telecom, as well as the pharma industry in India and international markets. I have also been honored to be featured in Business World 40 Under 40 Healthcare Power List. So beyond work, I'm passionate about cycling, dancing, and reading. Most importantly, I'm grateful for the constant support of my parents, my wife, and my two sons who keep me grounded and inspired. So I'm excited to be a part of your course today, and I hope you leave this session with practical ideas and you can apply immediately in your marketing journey. So welcome all of you, and please keep a pen and paper along with you so that you take the best of what we are going to share with you today. So the speaker for today's session, Mr. Vivek Desai, he has joined us today. Mr. Vivek Desai is a seasoned healthcare marketing leader with 20 years of experience across pharmaceutical, medtech, and consumer healthcare. As a head of marketing near patient care business unit at Roche Diagnostic India, he leads strategic marketing, digital transformation, customer engagement, and portfolio growth initiatives. Over the course of his career, Vivek has successfully built and launched brands at Roche Diagnostic, Impure Pharmaceuticals, Alembic Pharmaceuticals, GlaxoSmithKline, and Abbott. With a deep expertise in brand strategy, omnichannel marketing, product launches, digital consumer engagement, and commercial excellence. A postgraduate in chemistry from Mumbai University and MBA from NMIMS, Vivek is widely recognized for translating customer insights into impactful marketing strategies that drive business growth. So welcome, Vivek. Thank you so much, and really excited to have you here.
Absolute pleasure, Ashish. Thank you so much for having me here. Good afternoon, everyone.
Yeah, good afternoon. So with that, we start today's session. The breakup of the session is very simple. We are starting on time and we intend to close this by 1 o'clock. After 1 o'clock, whatever questions you are having in, please feel free to drop into the chat, and we will definitely have requested Vivek to hold us, be with us till 1:15. And whatever questions that we have, we will try and answer to this. And we are also helping pharma marketeers to understand this topic a little better by translating this into an ebook format. So whatever conversation that we are going to have today with Vivek, will be translating it into an ebook and sharing to all of you. So please be there with us. And more than the ebook, I would strongly recommend you please take notes and implement on what things we are going to share today. So the broad breakup of today's session is on reinvent and rediscover, reposition and realign. So this is the predominant topic that we are going to pick up across 5 questions. And this is going to be interactive. This is going to be practical, which we are going to discuss with Vivek. And certainly things that we have done at Medgini, we will also be sharing with you, which will be of use to your brand and marketing journey. So before we start our session, I would like to ask all the participants who have joined in today. We have got 50 plus people joining today. So we are going to ask you, where do you stand with your brand marketing journey when it comes to omni-channel? So I want all of you to answer this in the chat. Have you just started? Are you connecting the few channels? Are you fully omni-channel, or you are still in the traditional marketing approach? Please be transparent. Please be honest in answering this to us in the chat. Where do you stand today in your brand journey when it comes to omni-channel communication? So please put in the chat, where do you stand today? Okay, some people are saying fully omni-channel. That's really happy to hear that. Pallavi, Manoj, thank you so much. Aditya says connecting a few channels. Yes. And Loni says manual omni-channel. Okay, manual omni-channel. Great. Tanmay says still in traditional. Great. So we are here to help you understand what are the things that we need to be cautious about when it comes to omni-channel journey. And we are going to start the conversation today with Vivek, and this is going to be attractive. Before we start this particular session, I urge all of you to please participate in this self-audit test. Self-audit test, we have crafted 10 questions and which will help you understand where do you stand. So though the question previously was point blank in terms of asking you where do you stand, this self-audit test will actually tell you the reality. I want you to please scan the QR code, and two people who will be answering the first will be able to get the hard copy of the book, Advertising in the Age of Generative AI. End of the session, we will be announcing the winners, and my team will reach you out, take the address, and dispatch the book to you at your doorstep. So if you are done, please type in done in the chat. And if you have difficulty in scanning the QR code, my team has put in the link in the chat. It's easy for you to click on the link and participate if you are in a computer, if you are joining us from your desktop, laptop. And if you're joining us from the mobile, you can click on the link which is coming in from the chat. So this will take about 5 minutes. Please take your time, do participate. If you are done, please type in done. And backend team also is sharing me how many people have actually completed it. The first topic which we want to discuss in detail with Vivek today is on reinventing the brand. So we as pharma marketeers understand that the brand travels through its own journey, and we are here to service the market. So the first question for you, Vivek, is when we are talking about the established brand, what will be your approach to understand the market? So what is the market and how do we address the market? Over to you, Vivek.
Thanks, Ashish, for that one. And this is something, which I've always been thinking about. As marketers in healthcare and in pharma, one of the most interesting things, or rather two interesting things, is that, the consumer and the customer are not the same. Your customers may be the influencer who's a doctor and the consumer is the patient. So that's a difference between, healthcare, medtech, pharma, anything that you say. And the second one is you cannot be the consumer at all times. You are never the consumer at all times. I mean, what the patient is going through, what the pathophysiology is going through in the human biology of a patient's body and mind is not something that you can experience. So the first and foremost, whether it's an FMCG marketer or a pharma marketer, we need to first detach ourselves and practice a bit of a humility here. The concept is called humility of marketing. As the marketer, you can't think that you are the consumer. The first and the foremost rule, which I always try and put it in my head whenever we think or plan anything, is you are not your consumer. That's number one. And therefore, do not think for your consumer. Do not think like you think like your consumer. So that's one. And then comes a few barriers which you need to consider overcoming. And this is more like a reset conversation that we are having, Ashish, here. Not that we don't know about it, not that we don't practice about it, but the thing is we need to be a bit mindful. Pause and reflect is what we're discussing, and probably this is what the entire 45 minutes to an hour is going to be today. There are some of the barriers which we also need to be very mindful of, which are omnipresent. We all know something called as features and benefits, right? One of the most cliches. The marketeer thinks features, the consumer is always thinking benefits. We think we are offering benefits, but are we? That's the question. Another very interesting thing, which I've always had a conversation with teams whom I worked with or agencies whom I worked with. Have you ever heard any consumer talk about their competition dikhana? Right? Nobody asked for the word competition. We think competition. The customer thinks alternatives, right? And therefore, the moment we start thinking what is the alternative that the consumer is going to be considering, the customer is going to be opting for, is when you start thinking, how can I be better, or am I already better, and what do I need to get there? We think positioning, the customer thinks perception. And therefore, think about the perception of what the customer thinks your organization, your product, your brand, and your approach is versus what you think the positioning statement should be resonating, let's say, with the doctor or the pharmacist or the end user or the end buyer. And another very interesting factor here to reorient, understand the market, or maybe to unlock growth opportunities is to understand where your organization is at. As an employee in a department within an organization, it's very important for you to figure out, if you have not figured it out already, that what is the core competence of my organization. There can be an organization who is highly scientific, science-driven, talks about, let's say, for example, bioavailability, yield, efficacy, clinical data, so on and so forth. And at the same time, there could be another pharmaceutical or a healthcare company which would probably speak more about same molecule, better prices, same molecule, wide availability, same molecule, better pack sizes, so on and so forth, right? What is your core competence? What is it that you are good at, not good at, best at? And then probably try and operate from there. Suddenly the journey starts becoming more meaningful, where you think you are not the consumer, where you know what the consumer thinks, and I mean, you will never be able to know, but you at least get to the closest that the consumer thinks what they are thinking, and then I also marry it to what your organization stance is, and then probably you will be in a better position to orient yourself towards the market. So fundamentally, Ashish, what we're discussing here is from being product oriented to being market oriented is what the starting point is for any marketer or anybody who is at the synapse of making the organization see the market, because the marketer is the closest to the market. The salesperson is also closest to the market, but the salesperson execute. They are doing what they have been asked to, execute. They're not the thinking tank. The thinking tank, if they are the marketeers, then probably they'll be able to, bring the reality into the organization. And for the person who needs to bring the reality has to be, very much oriented to the market and not to the product or to the organization, so to say. I mean, probably also give you an example here of a research which was done by a TV broadcaster in Canada called Think TV. They asked two different cohorts, one the advertising agencies and other the marketeers. Okay, they asked them at the turn of the social media boom, way back in 2015 2018 period, that how many customers do you think are on Facebook and how many are on Instagram? That time it was not Meta, it was Facebook and Instagram separately. Interestingly, the advertising agencies said that almost 80% of them were on Facebook and almost all, it's like 95, 96% were on Instagram. And the marketers thought that people on Facebook were just about 80. So, more or less the Facebook, stats were matching. But on Instagram, it was just about, 33 or 34 odd percent. When they actually went and asked the consumers and checked that are you on Instagram or are you on Facebook, where is it that, therefore the marketer needs to put their money on. While the Instagram, I mean, the Facebook numbers were more or less in place, which was at about, 90 odd percent, 80, 90 odd percent. Instagram was almost 100%. So the marketer was always living in that particular naya hai. Will take some time, but you never know how fast the market has already evolved. And I'm talking about a research which has already been done and published. So this is where we are at. Are you outside in or inside out? Are you product oriented, market oriented? Are you talking the consumer, thinking the consumer? Are you removing the barriers or already acknowledging them? That's a good starting point for any marketer, I would say, which can be done at any point in time of your career or your job or your profession.
So, Vivek, I like the topic which you have talked about, which is you are not your customer, and definitely marketeers are the think tank and salespeople are the executor. I wanted to understand a little better about the market. Nowadays, we are talking about companies looking at rural markets. How feasible it is for marketeer to look for new markets. New markets can be beyond your current serviceable area. So, should we get excited when we hear about that this is a new market, just go for it? Or as pharma marketeers, what is the step back that we need to do before we actually commit ourselves? Because we all are limited in terms of resources as well as budget. So how do we actually react when it comes to new markets?
Okay, that's again a very a classical conversation that you probably see in the boardroom, and the big decisions being made. Going rural, going deep, going penetrating wide and deep both ways. Again, this is where the organization needs to understand which category are we in, what product solutions are we offering to the market, and where is the access happening. Once these questions are answered, I would say, Ashish, then it would be in a better position to understand whether there's a demand which already exists in a particular geography or a particular, segment, so to say. And therefore, defining and redefining your TAM SOM at all times will always help you to decide where is it that you want to deploy your resources and your money, because you might not want to go after all the segments, you might not want to go after each and every market, but then probably invest where probably your access is already in place, or you can deploy some resources to drive access, and then maybe the consumption can be driven. Again, we are healthcare, we are pharma, which are need-based products, which are not impulse products. We are only consumed when a need arises, and that need is actually already a problem for which a solution is being sought for. And therefore, where is the problem being solved? And for that solution, what products are being used, or what solutions are being, deployed, is basis that you probably able to decide whether it's a metro or a tire or a state capital tire, or going to multiple tires below the initial tire markets, or actually going to the rural markets. Case in point, COVID, and the classical example of paracetamol 650, which was not available in any other brand except Dolo. And suddenly Dolo had the inroads into each and every marketplace in India, given the fact that the COVID fever was only going after a 650 milligrams of paracetamol and not a 500 milligram or a sub 500 milligram dose. Now Dolo never planned for it, but then because that particular product was available, the market found its way. And then probably you need to understand, if I am Dolo, that how is it that I sustain this, and how is it that I create this distinctive advantage that I have got to become that particular differentiated offering that I'm putting out in the market. Hope that helps.
Perfect. I think that's what you're talking very practically, that we have to definitely be cautious because we are talking about cautious about our resources as well as our budgets when committing ourselves to new markets. So there is a follow-up question on what we are talking about next, which is market research. So we understand that companies deploy in-house team as well as outsource agencies to understand the market better. And coming to market research, we wanted to understand how does market research help the brand, and what are the ways and means the market research that really gives you answers to problems that you are currently facing.
This is a great segue into what we just spoke in the previous bit.
Yeah.
To me, any business or any business planning is split into three parts: 33.3, 33.3, and 33.3. The first circle, the first 33.3 is research. And glad that we are a part of the healthcare industry, and most of us are from pharma and healthcare background. It all starts with diagnosis, then identifying the line of treatment, and then adhering to that particular line of treatment to get the desired outcome. If we understand that as the classical way in how healthcare is provided, market research is the diagnosis, is the first 33.3 of the circle that I'm talking about. uh, is because unless and until you diagnose, you don't know what the treatment is supposed to be. So market research follows strategy, and strategy follows the tactics. Now, when you talk about market research, of course we all know there are multiple qualitative and quantitative measures. Some of the most easiest ways to go about is secondary data, which is always available, very low cost, always available whenever you need. And you can definitely use the secondary data to also, use it as, a synthetic data for synthetic data analysis. But when it comes to some of the other type of researches, which is qualitative researches, is where I feel marketers should definitely, consider investing some time on. Uh, because first of all, a marketer is always a curious person, and therefore that personal curiosity is something which should always be, on top. That you have to, keep thinking about and start building hypotheses around it, right? Once you build the hypothesis, find a dedicated time to be able to conduct those researches, to be able to diagnose, identifying the right channel or the right type of research that you will deploy. uh, and then once the data is available, you need to be able to pay attention to the data. It's not just about paying attention that I'm talking about paying attention, but it's about ruling out biases, prior experiences, anecdotes, or how is it that the decision making authority would view that particular data point as. So pay attention to that. Help change mindset, first of all of your own, and then of the decision making team. And finally, commit to it to be able to do it. Now, you might think that data is available in plenty. I have the syndicated data available from the agencies which my organization subscribe to, and I keep getting it. Those are your macros. Okay, those are your macros, which will give you the directional input, because it's a trend data, and it's always great to have a trend data to be able to see the lag and the lead indicators for you. But I would strongly recommend, every marketer to invest in their own research, to build their own hypothesis, test it, and talk to, your respective team below, above, and at your level, to be able to make some good use of the hypothesis that you as a team have built. There's a simple, tool which is available on the Google. You might just want to, type it out on Google as sample size calculator, and the first link that opens up, you just click on that. It will help you build the right sample size basis what your confidence intervals and degree of error or the margin of error that you want to commit to. Now, we all want our decisions to be 100% right, okay? But then here is an exercise which you can probably deploy by saying that I want my decision to be right 70% of the time. So that's the confidence interval that I'm talking about. And I'm talking about a margin of error, which is 10%. So 70% of the time, if this decision is taken, it will be right with a margin of error of plus or minus 10%. And when you check the sample size for that particular, outcome that you're looking at out of your survey, and even if you keep your sample size as infinite, you take the entire country population, more than 140 crores, your sample size will not grow beyond a particular threshold,
Yeah.
which you yourself can deploy as a survey in the market or with your team. And then maybe test those hypotheses, come back, and then triangulate it with the big data which is available, and then synthesize to see where you are heading towards. And this is where, which is the most important point, getting into the strategy without research is, trying to go for a treatment without any diagnosis, so to say. So that's the importance, of market research and
Yeah.
research per se before any planning, so to say.
Perfect. So I think one of the experience we had at Medgini when we were called upon by one of the brand which is into anti-cuff category, where we wanted to understand the chemist behavior, patient behavior. So we did a mystery shopping in geographies like UP and Bihar. where our people were deployed sitting in the outlets and just observe the conversation between the patient and the chemist. So patient, is he being price conscious, or does he have any brand inclination in mind? And how is a chemist able to influence the sale of a particular brand? So in market research, this is something which brands and companies are also deploying to understand the behavior at the ground level, be it for patient, be it for chemist. I'm sure they are doing a lot of work at the doctor side as well. But this is something which we have learned recently. Anything practically you have seen, Vivek, at your end when it comes to market research?
Oh, I can probably share a very interesting example here, and especially for consumer marketing companies or OTC brands for
Yeah.
that matter. You definitely have a customer care center. Uh, Try and listen to the calls, the transcript that your customer care can provide to you. Identify those customers who really asking those questions where you feel they're looking for a solution. Try and meet them. This is something that we do, or we've been doing, irrespective of whichever organizations that me or my team would have worked, is go for consumer home visits, meeting the target group, the patient, and their primary and secondary caregiver in their own households for about an hour or two, having a freewheeling chat. No pen or papers in the hand, but having a conversation in terms of what's a day in life with this particular condition that you are living. And I'll narrate you a very interesting example, something that happened with us in Tamil Nadu. Uh, we were at this household. Let's say it was an ACC B1, a household in some place in Chennai. I don't exactly remember the locality, but we were with a translator because none of us would be able to speak Tamil. So I asked a question, to be asked to the caregiver through the translator, that how is it that what is it that you are, where is your mind is at, with your husband's condition. They started chatting, and suddenly she started crying, and the husband started shouting at her. And we were all petrified that this is going somewhere else. And then we're
Mhm.
like, okay, we'll leave if this is getting uncomfortable. And then she said something, the moderator started laughing, and then she explained to us that the husband was a diabetic, or is still a diabetic, I believe, and he likes to eat chocolates. Because he wants to eat chocolates, he injects himself with an extra dose of insulin, goes into hypo, and then shows me the glucometer reading saying that I'm into hypo, give me chocolates. Now, think about how your consumer is hacking your product
Mm.
and what's
True.
happening in the life of a consumer, and how is it that you need to then talk. We are talking about you should monitor your glucose levels, is because it will help you manage your diabetes, or know at least where your diabetes is headed. Here is a consumer who's actually using the product to hack the entire system, where he is hacking insulin, he is hacking the glucometer, and it becomes an interesting story. Now, we would have not come to know had we not known these kind of things also keep happening in the market. And therefore, listening to your consumer, talking to your consumer, visiting them, brings a lot of insights back into the organization.
Absolutely. I think companies have to definitely allocate a KPI when it comes to market research. Market research can be at various life cycle of the brand. And as you said, the hypothesis as well as the outcome has to be clearly defined so that you get what you are actually looking in for. So with that, we move forward to the second part of our conversation today, which is repositioning. So when we are talking about positioning your brand, understanding the market, doing a little bit about market research, listening to your customers, and then we are talking about repositioning the brand. So when it comes to repositioning the brand, the first question which comes to our mind is how to ensure that our presence across various stakeholders, because we are in the healthcare industry, be it OTC, MedTech, the stakeholders are a lot of them. So caregivers, patients, doctors, trade partners, emerging channels. So as marketeers, how do we ensure that the communication or the positioning across stakeholders is uniform and consistent?
when we talk positioning, reposition, Ashish, probably we talk positioning, but then positioning cannot, come in before, targeting. It always comes after targeting, and targeting comes after segmentation. So this is classical the STP conversation that we are,
Yeah.
talking about here. Now, to be able to reposition yourself or be consistent across all your stakeholders, you need to first understand who your stakeholders are and segment them and identify which are the segments that you want to go after. Is the segment sizable enough? Is it going to give me the desired returns? Is it going to continue to grow? And is it a segment where preferably my competition may not want to or is already not participating? That's the best space to be in. If you're able to find that space, and I'm sure if you look deeper, if you work on your research as well, if your orientations are towards the market, you will be able to find that segment, because you just need to start winning in one to be able to start winning in the other, right? So once your segments are in place and your segments are cohesive and uniform, and when I'm saying this, what I'm trying to understand, help our audience understand here is that you cannot be a scientific brand in a doctor's chamber and a high margin brand at a trade or a retail channel. You cannot be two different things to two different channels. You have to be either or. And you have to let go of something here. And this is where the second circle comes in, the strategy part, the 33.3, the second 33.3. Your diagnosis market research is done. Here we are talking about strategy, segmentation, targeting, positioning. You got to be very clear on what you are not going to go after, identify your segment, and then start targeting them with what is it that you're going to be telling them about. Whom are you talking to? About what? Versus which other alternative, and why they should consider you. Once that is done, then you come to the positioning or the repositioning part of it. Now, when we talk about positioning per se, there are very interesting two topics or two things only that you need to keep in mind. Am I distinctive and am I differentiated? Can I hold that distinctive position consistently in the mind of the consumer? The distinctiveness could be anything. It could be the color of your brand. It could be the logo of your brand, the slogan, the celebrity, the imagery, the sonic cue. You think Netflix, you have, the Netflix sound. You think Britannia, you have the Britannia sound, for that matter. What is so distinctive that you can hold that particular position throughout, which only you can hold? Then comes the differentiation, which is not replicated, which nobody can replicate, which is something that only you hold as a position. Now, in theory, this looks perfect. That कर देंगे boss, distinctive भी कर देंगे, differentiated भी कर देंगे, हो जाएगा. But in practical world, doesn't happen. And I'm telling you is because, if I was an audience member here, like कुछ भी ऐसा थोड़ी होता है. Anybody can copy and anybody can, get on to what I am getting at is because they see success there, right? Success is infective. Success, has followers, right? And therefore, when I talk about these two words, distinctive and differentiated, there is a word that, joins the two with relative distinctiveness and relative differentiation. Can I be relatively better than what the other alternatives are in the market, which the consumer will be able to recognize and value for? That is one. The other part is, can I do this consistently enough at the pace and with the energy and the resources that is the most optimal resources or the energies that I can deploy? And if I'm able to do that consistently for the target that I'm looking at and the segment that I've identified, then I will be a very cohesive brand across every channel where the consumer is passing through as a journey. So a doctor would appreciate my brand for what I bring to the doctor's table to help him or her, provide the best treatment and solutions to the patient. To the pharmacist or the retailer, where your retail or the trade channel is going and talking about in terms of availability, merchandising, throughput, depth and width of distribution, engagement, merchandising, so on and so forth. It's the same brand, which stands for the same purpose and the same value, which is at the doctor's clinic. Of course, the metrics might be different. And finally, the consumer who experiences the product at a prescription or at a recommendation at a doctor's level or at a retail pharmacy or in the media, whether it is ATL, BTL, digital or new media, it is all cohesive and consistent. If you are able to build that, then I'm sure the repositioning or the positioning part is something which will be very clear in the minds of the consumer, and you will be able to consistently get where you are wanting to get. And it's not a straight road, or it's not going to be a smooth road which will go downhill. There will be peaks and troughs, but you need to be committed to it, and that is what your organization should also be able to back you up with. And for that, again, you need the right data and the right approach which is backed by the data for you to be able to stand your ground. So that's how probably you can position and reposition across the entire continuum of customer sets that you might have.
Perfect. So one thing which I have observed is a pharma company which talks about best quality medicines at best price. So that is their positioning, be it for doctors, be it for the chemist. That is their corporate positioning, and it is for the patients as well. And we all know what exactly is the company name, and that's how the message has been deep rooted over a period of time through TVCs or through various communication. So I get your point that the core message has to be consistent. So what exactly is the core message? You have to deep dive. Where exactly are you going to differentiate yourself, and how are you going to harp on this particular communication consistently? Right. So that is something which is very insightful that we are learning from you today. And
I'll give you another example, Ashish. I'm sorry, but
yeah,
there's another example that comes to my head, and I'm sure everybody is a consumer of those two brands or those two product solutions, Amazon and Flipkart. Now,
yes.
Amazon globally, has been talking about, three things. That I will give you the best catalog at consistently good prices. I'm not saying the best prices, but one of the best prices across the entire spectrum category, and it will be very convenient for you. I'll make it very fast,
Mhm.
and then I will integrate it to everything that I do. So whether it's
True.
Amazon.in, or whether it's Amazon Prime, or whether it's Amazon anything in
Mhm.
the entire Amazon conglomerate or the ecosystem that they work with. And this is what Amazon's positioning is. And if you see the Amazon buyer particularly, they are the HCC As and HCC up to HCC A to B1 is where you see the Amazon buyers, mostly metro centric, mostly urban markets, is because that is how they position themselves. But when
True.
you look at Flipkart, which now
Mhm.
is owned by Walmart, they are
Mhm.
very much clear in terms of where is it that I will position myself and what is it that I will offer to my consumer. So probably they are, the minute deal providers. They are probably targeted more towards the hinterland. The catalog is not as enriched as Amazon. The experiences might not be at par. But what they have identified as a unique position for themselves is, let's say, for example, electronics and mobile phones. Even the entire country, whether it is metro or tier towns, if they have to buy electronics, the go-to places is Flipkart, is because there is nobody better in terms of Flipkart which sells electronics the Amazon way. The biggest catalog, the widest catalog at the best available prices and the convenience that you provide. So now, how is it that you are able to position? How is it that you are able to create that relative differentiation is where the consumer will know where I need to go and how I need to shop for that particular solution or the job to be done. So for that matter. Hope that helps.
Perfectly. I think now that we have got a clarity on the core message and how we need to carry this communication consistently, the next challenge which marketeers today is facing in terms of channel of communication. So now we are sitting in a digital era, and we have so many options when it comes to digital channel of communication. So with your experience, what digital channel really works the best, because we all are having limitation with regard to the budgets as well as the resources. So what digital channels really work best for communication?
Uh, Before we go, into the response of it, I would strongly suggest everyone to read a particular article. I mean, you can just type it, the long and short of it on the Google, and just, add a plus marketing to it. Because this is where, this conversation or this particular section is what we're going to be addressing. Now, we're talking about channels. And this is also a topic about multi-channel marketing. And at the start, we spoke about omni-channel marketing. And these are two very easily used terminologies that we keep using on and off: multi-channel, omni-channel. And sometimes it's very interesting for people to not be able to differentiate between the two. But then without making any comment here to anybody's intelligence, I would really want everyone to think, what's the difference between the two, and then again think whether you're omni or multi-channel. And we can touch upon it if we have some time in the end. But coming to the channels, okay? Now, the channel selection or the go-to market. Now, this is the go-to market or the channel selection conversation that we are having, and this is the third circle, the 33.3, the tactical part. So you've done the diagnosis, the market research, you've done your strategy, segmentation, targeting, positioning, and now we are into the tactical part of if my strategy is baked enough, if it has been, it has been sitting for a while and it is getting stronger and stronger, then I get to the go-to market and the funnel. Now, again, everybody knows the marketing funnel: awareness, interest, desire, action, or awareness, consideration, evaluation, post-evaluation, pre-purchase, at purchase, just about purchase, post-purchase. There are so many things everybody talks about, right? But this is the beauty of the marketing funnel, that you can adopt one or the other, but don't adopt something just because you think it was there on the previous person's slides, or it was something that was told to me, or it was the first beautiful image that Google threw up to me. Rather, as a marketer, if you've done your research right, if you've identified the right segment with the right targeting and the relative differentiation in terms of the positioning, that you have built, then now is the time for you to think customer journey. What happens in the mind of the customer or the customer, consumer, doctor, pharmacist, patient, everybody, okay? जिसके भी बारे में सोच रहे हो. What happens in the mind and then the life of that particular potential buyer when they start the journey, and where is it that they end the journey to consume or pay for that particular product to essentially get a job done? That journey could be different for different therapy areas, for different consumers within the same therapy area, in different geographies at different life stages. It could be very different. But create a uniform funnel, which is your own funnel. And it could be very different, let me tell you. And I'll give you an example. In healthcare, I experience a symptom, I ignore the symptom. I experience the symptom, I do home remedies. I experience the symptom, my first point of contact is family physician. My family physician treats me, I'm good, I'm out of the funnel. My family physician cannot treat me. The family physician prescribes a particular test. The test throw up something, and then I'm actually on to a specialist. The moment I'm on to a specialist, I go for an advanced diagnosis, and I know, lo and behold, I have a bigger condition to tackle. And then, the journey continues. Or there could be another journey. I'm experiencing a trauma or a critical, acute condition, and I'm immediately at the emergency department of a hospital, and this is how, the consumption would happen. This one journey. You talk about insurance. Insurance, I will have to probably decide how many calls I will have to make for this particular person to at least start thinking that they want to buy an insurance policy, right? And then when they are buying an insurance policy, which one they will go for. Now, this is what I'm fundamentally talking about. That funnel has to be your distinctive funnel for your category, for your product, for your industry, for your customer journey. Number one. Number two, make sure that your top of the funnel is the entire market. Here, you don't have to think segments. And I will take only one segment and that journey. Because funnel mein sab log hote hain sir. Everybody is at a different stage, but put everybody on the top of the funnel there. And then see how is it that the funnel is translating as you go down. Okay? And when you're going down the funnel, see where the maximum leakages are or where the maximum dropouts are. Okay? Uske baad, the core competence of the organization, your team, and of course, you mentioned a very interesting word, budgets. What is it that you have as, the resources that you can deploy? Basis that you decide where is it that I want to work on. Yeah. And this is where the first article which I spoke about, the long and the short of it. At the top of the funnel, TOFUs, talk about or invest in the long-term strategic growth or the strategic, objectives of the brand. But at the same time, you also got to get the money coming into the organization. The kitchen has to run, the salaries have to be paid, the bottom lines have to be achieved, and let's be practical there. Also look at the middle to bottom of the funnel, where you can also act upon to drive conversions, to drive purchases, and continue to have the funnel flowing. So ऊपर से नीचे भरते रहो, नीचे से productive outcome निकालते रहो. This is how probably you need to figure out. Now we all know, and I'll not go into the fact of ATL में क्या use कर सकते हैं, BTL में क्या use कर सकते हैं, top or middle or bottom में क्या use कर सकते हैं. That is where we are all quite adapt and adept at. But approach should be this, and this is how probably you should also approach your media planning. Talk to your media agencies and revisit those plans basis the funnel that you have created. Okay. Now, for example, lastly on this particular bit, if my universe or top of the funnel is 100, the consideration, and I'll just use awareness, consideration, evaluation, and purchase. Okay, let's just take these 4 stages only for the moment, for an example. From 100, if my consideration is coming to 50, from 50, if my evaluation is coming to 10, and from evaluation, evaluation to purchase from 10, it is only coming to 1, then I need to decide where the maximum leakages are. Why I'm using this example, my dear friends, is from 100 to 50, it's a 50% leak. But from a 10 to 1, it's a 90% leak. Now, somebody is already at the evaluation stage. वो रुक चुका था. That guy was going to come and purchase, but only one purchase. What's happening there? If I'm able to convert, 1 ke jagah pe, if I go to 5 and make it at the same 50% leak, will I start having better conversions of my campaign? Then I need to decide which areas would I want to work on, and where is that conversion happening? Where is that purchase happening? Is it happening at the point of sale, online, offline? Is it happening at the doctor's clinic where the prescriptions are written? Where is it happening? And that is the channel that you select. And that is how the multi-channel approach is that you will take. Able to do it, not able to do it, you will have to keep practicing it. But back it up with data and do it for the right segment. I'm sure gradually you will start seeing the results out of it.
Right. That's right. So I think I love that particular point that first, obviously, you understand your funnel, and after that, you then define what are the channels that you would like to pick up in the customer journey, in the patient journey, so that you really get the maximum out of it and ensure and keep determining where are the leakages which are there, so that you get the best of your customers into your conversion stage. So the final thing, now that we have learned a lot about segmenting, targeting, positioning, understanding your target audience, defining your core message, as well as picking up the right channel of communication. The last major concern for marketeers is ROI. And coming to ROI, they are metrics which marketeers need to set up. So the question which is coming into our mind is, as the customer journey evolves and the brand journey evolves, and you are picking up multi-channel approach for making your brand present across various channels, and you are also being responsible for the ROI. So what are the metrics and KPIs which are very critical for you to set up and to understand that whatever you are investing is actually worth the worth the attention that it requires?
This is where the rubber hits the ground, no, Ashish?
Yeah, certainly.
Okay. No, I mean this is where I've seen the biggest heartburns on the marketing team, or the biggest frustrations, or the biggest conversations in the capital. उसको समझ में ही नहीं आता है, kind of a conversation. And I totally empathize with both the sides here, given the fact that end of the day, business is for profits, and if profits come in, the business continues. And at the same time, I'm also being mindful that it's because of the the customer you have a market, and because of the market, your product actually is a solution. So you have to
Yeah.
balance both. Now, this is again where the marketeer has to very clearly, draw a line between what is strategic objectives and what are tactical objectives, right? Both the words strategic and tactical has the next word to it is objectives. And this objectives has to be objective. It cannot be subjective. Strategic objectives are long-term objectives, which actually should not be ideally at a monthly or a quarterly level, but it could probably be breathing for a longer period of time, maybe biannually or annually, or at least on a 3-year journey, for you to be able to measure the brand metrics here. Okay. Now, to be able to measure the ROI on the strategic part, you might be able to look at something called as brand lift studies or net promoter scores or the attributions in terms of the touch points that your brand is able to build, and commit to what is it that you will be able to translate those qualitative parameters into actionable numbers at the end of it. And that is where the correlation or the synthetic data analysis or triangulation comes in, right? Do that, commit to it, and allow it to breathe. Branding is not a fast food. Branding is really slow cooking. And that is what you need to be able to invest in. If you are able to invest into that, great. If you're not, find time to have those conversations to be able to invest, is because we're talking about brand building here and we're not talking about product selling. Okay, that's one. Now, how you will be able to do it? Again, I'm correlating to the funnel that we spoke in the previous section, that if you're talking about the long of it, the top of the funnel is where you build your strategic objectives to get more and more people starting to see your brand, consider your brand, and start evaluating your brand. The next part, which is the short of it or the tactical part, is where your month closing, your quarter closing, your half yearly closing, your annual closing, and the ROI metrics have to start coming in. And this is where you speak more on the conversions. This is where you speak more on the annual sales and profit, where you speak about the growth, where you speak about the market share trends. Okay. And again, market share is another metric, which is a very interesting metric, which people look at it in isolation. The same year last time December में कितना था? ऐसा नहीं होता है. The market is constantly working and market never stops. And therefore, your market share is not a milestone number. It is a trend number. Are we able to maintain it? Are we increasing it? Are we decreasing it? Or what's happening to the market share relative to what the base the market is from that perspective? So look at it at a trend level to call it out as a lead or a lag indicator again, and then maybe build the customer journey. And in every journey touch point, the channels that you subscribe to. So let's say, for example, if you have subscribed to a digital marketing campaign on Meta or on WhatsApp or anything, email marketing for that matter, the classical Excel sheet table remains the same in terms of what was the universe that you signed up for how many impressions that you were going in for. Of those impressions, what was the total OTS or the opportunity to see? How much was the total VTRs or the CTR that you are generating? And of those VTR, CTRs, how much is the conversion that you are getting? Your agency will give you a metric. You will have to build your own metric basis your previous campaigns. If you don't have a previous campaign, start first and then try to build a correlation to how is it that the same metrics have been performing. Now, in this exercise, what my personal recommendation to every marketer here listening to us would be to spend some time on identifying your universe, which is not something that your third party agency will be very empathetic towards. They'll probably read your brief and come back to you with the particular category or the universe that you speak about in terms of मेरे को metro target करना है, for example. They will say, okay, fine, which metros and how much money you have. You say, I have 1 lakh rupees and I want to target 6 metros. They like, no, okay, 1 lakh में only one metro आएगा, pick and choose. Now, these conversations when you are having with them, make sure that you know whom you are going to target and spend some time there. Read through, let's say, for example, the target profile that they are giving you, read through the keywords that they are giving you and identify whether those keywords are really going to be working for you or not. But you will only know it if you know who your segments are, and you will only know who your segments are if you have your researches in place again. Now, when you do this, your metrics will more or less start talking to each other. Because आज जो आपने strategic objective लिया था, whatever was the strategic objective today, will start becoming a tactical, at the end of that strategic period. And today's tactical objectives will continue to tell you how your previous strategy was working. So it's an ongoing process and an ongoing cycle for you to decide how you measure the KPIs and how you measure the metrics.
Certainly. So I think the point which actually resonate among the many things that you have shared with us is the Net Promoter Score. So this looks very fancy, but this is very important for us to understand the stickiness of our customers to our brand, right? And we have been discussing about it. So Vivek, as marketeers, with the objective of understanding customer stickiness, customer loyalty, Net Promoter Score has to be done at what frequency? Monthly, quarterly, half yearly, annually?
Great question. I would say, this is a very cliche one that I'm going to tell you. It depends. Okay.
Okay.
Why it depends is because, the frequency is dependent on the life cycle of your product category. Okay. If a product category has a shorter life cycle, you do it faster enough. If you have a longer product life cycles, you do, with a particular, gap in between. After you've reached a particular number of life cycles being completed for those questions to be asked, that gives you, a fair bit of, or that gives us a fair bit of idea on kitna frequently karna chahiye. Okay, how frequently you should be able to do it. Now comes what should be the metrics of measurement and how do we read the net promoter scores. This again depends upon different benchmarks. Okay, and let's look at it from the perspective that to get into an IIT in India, you need to score nothing less than 100, for example. 100 नहीं आया तो नहीं मिलेगा. But at the same time, to get into a good commerce college, you might be able to get there with 93, 94 as well. And to get into a good arts college, you should be able to get a good 85, 90 as well. And to run a business, even if you've not studied, no problem. You can still run a successful business and you can say I'm a dropout. So now where do you define what is, the right way to, measure and, build how the promoters or net promoter scores is. But having said so, when you start out, and what is the benchmark that you create for yourself is also something that you should be able to match with the other competitors in the category or the other alternatives in the category. That becomes your benchmark. In some categories, say for example, hospitality will never have a very high net promoter score because people always expect more. That's hospitality fundamentally. So let's say hospitality has a 18 on 100. It's a great score because that's how hospitality works. But at the same time, the moment you, let's say, for example, go to some other category, let's say electronics, suddenly the net promoter, the benchmark becomes 52, 53, 54, right? And similarly, healthcare, again, it differs and it depends. And that's the reason I said depend. But you start with yours, fundamental classic questions. How would you rate the product that you bought on a scale of 10? 1 is 10 and 10 is 100. So you will multiply it and then, create a score out of 100 there. Why did you buy this particular product? Did it serve the purpose for, what you bought it for? Would you continue to, keep buying this? Would you recommend more people to buy it? What is it that you would want to talk about, what didn't work for you or what could this product do better? Fundamental questions, nothing that we don't know of, but you need to commit to it, do it, find time, change, be ready to change the mindset and act on the outcomes. Once that is done, continue to do it consistently at a life cycle period of the product category. And you will be in a position to correlate that with the market share, to correlate that with the ROI, to correlate that with your, positioning, and to correlate that with your market research data. So it's a cycle. It's a wheel that will continue to keep turning, and it's not a mouse wheel, but it's a wheel of time, I would say, which keeps coming back to the same, number after every periodic time. But the the time that you spend and the job that you do at each of the different points during the entire cycle will decide on how the next cycle will look like, because it's a cyclical process. Customers will keep coming, they will keep buying, they will keep rebuying. New customers will come and they will also follow the same cycle, and your customers will also continue to evolve and graduate. Given the fact that the world is changing very fast, I mean, for generations which are on the call right now, there are a few who have not seen telephones inside the house to, talking about, telephones being obsolete and something else is going to come. And to the generation who's, going to come into the industry in the next 5 to 10 years are going to be natives of the digital world. They have never seen what's, a circle wala phone is going to be looking like. And for them, it's like a good piece of art. So the customers are evolving, the learning curves are evolving, their perception, their values are evolving, and therefore you need to be able to talk to those, evolving customer segments and not say, "हम तो ऐसे ही करते थे, यहाँ पे तो ऐसे ही होता है." That's not how market works, right? And let's acknowledge that. If you're able to do that, then we'll be in a happy space. If you don't get to do that, come on, we're not here to solve everything, my dear friend. I mean, let something be imperfect as well. चलता है, okay?
Great. So I think I like the perspective. No, Link is working for the self-assessment test, and we've got people who have participated as well. Aditya, can you check it once again? I tried it myself. It's working. And if not, we can send you the link on WhatsApp as well. Fine, fair enough. So with that, we come to the end of the webinar, but we had something interesting that we have learned today with the conversation that we have built up with Vivek. And any questions, participants that you have, please feel free to drop in the chat and we will be able to pick it up. Until then, I request you to please participate in the self-assessment test, get a score in terms of multi-channel marketing adoption score. So where do you actually start? That is the first time that we are actually building up this self-assessment score, and you will be able to get the score on your email, which will help you understand where do you stand today. So going next in this particular session today, just a minute. Yeah. So please give us a feedback on what resonates with you with regard to today's webinar, the content, the speakers, relevance to your business. Please take 2 minutes of your time, scan the QR code, give us a feedback. And whatever topics that we have built up in the past 27 webinars has been purely on the feedback that we have got from our participants. We make sure the speakers are selected in a way that they are able to do justice to the topic. And we also ensure that the topic deeply resonates to your needs, challenges, and problems. So with that, please give us a feedback on what has been the quality of the webinar which has served you today. Coming to Medgini, we have started this in 2012. We are helping pharma marketeers in awareness, availability, visibility, as well as accessibility solutions through technology. And we are working with large pharma companies as well as MedTech companies, OTC companies, FMCG companies, and it has been a wonderful journey. We are physically present in Hyderabad as well as Mumbai, but available on a call wherever that you want us to service you. So these are the major services that we are providing. Please reach us out if you would like to connect and work with us. And that's it. I think on behalf of the entire team who has worked to make this session doable, I thank Vivek for his time as well as his knowledge. And on behalf of the team, there is a book that we would like to give it to you, which will definitely be of use to your career as well, which is Advertising in the Age of Generative AI. It's the latest book which has been authored by Subbarao, is a renowned author. We have been following up with him since a very long time. He has written more than 24, 25 books in the pharma marketing domain. So I strongly urge people to grab the copy of this particular book. You may find this in Amazon. And yes, so this is how we come to the end of the webinar, but we are going to announce the winners for today's session. Just a minute. I may have the list from the team. Yeah, so the two winners who have participated, there are many people who have participated, and the first two people who have responded to the self-assessment test is Mr. Raj Purohit. Raj Purohit, hi, congratulations, and thanks for your active participation throughout the session and winning this particular book. My team will reach out to you. How has been your experience today?
First of all, I'd like to thank you, Ashish, for this wonderful session. This is kind of a forum which really brings all the marketing onto one table and start asking questions and kind of do an introspection in terms of where we are heading, what is it? Because into a day-to-day job, we really don't get time to really think, strategize, and then realign. But this gives us some kind of introspection, and specifically listening to Vivek has been an absolute pleasure in terms of, what are the various strategies, 33.33. So there is a lot of things which we'll take home in terms of what we're going to do forward. And I would say the next Monday is going to be really awesome. How really do we, put this onto table and make this happen? So yeah, thank you so much.
Thank you so much for joining in. And the second winner from today is Mr. Tanmay. Tanmay, congratulations. You have been regular to our webinars. Thank you so much. And how has been your experience in today's webinar? Just, yeah, you may have to unmute.
Yeah.
Yeah.
Thank you so much for this arranging this session. It is quite interesting because the kind of company that I work for is quite traditional. However, it is interesting to understand that how what are the basics. So I have a question for Vivek sir. Like I probably missed out on one thing. First of all, thank you so much for such an interesting session. I'm not comparing. All sessions are good, but this was kind of crisp to the point and literally made me I filled few pages of my diary to revisit, which does not happen always. So quite interesting for me, to be very honest.
Thank
I
you.
have a question, sir, that the first 33% being strategy, second one being the strategy. I probably missed the third 33%, the third pillar of, and what was the and we are talking about how a business should run, right? I mean, what are the pillars of business or any strategy or any marketing plan or campaign? Probably
Yeah,
that was. So can you please, a little bit of take me through that once again?
sure.
Yeah,
The
yeah,
remain.
sure. Ashish, you want to take it? You want me to take it?
Yeah, Vivek, over to you. It's your topic, so please go ahead.
No, no. I already saw somebody wrote it in the chat, but Tanmay, good for bringing it, back to remember how the entire process would work is just remember how our healthcare is: diagnosis, treatment, and then adhering to the treatment very regularly to derive the regular outcome. That's what I spoke about when I started talking about the 33. अब
Yeah,
diagnosis कैसे करोगे? The first 33 is research, data, and putting all the hypotheses being tested and the data talking to you, and not anecdotes or experiences. Let the data lead the decision, right? uh, the next 33 is your strategy, which is classically your segmentation, your targeting, and your positioning. Allow the second 33% to sit and bake. Check it with somebody who does not understand your industry, your category. कोशिश करो उनसे भी बात करने का, to show them at a point in time कि ये कैसा लग रहा है. Take an opinion. Get some outside industry perspective as well. Get some other therapies perspective as well. And then the last 33% is tactics, right? Because we've all heard this that good strategy, bad tactics doesn't work. Good tactics, bad strategy will still be able to get you somewhere, but you don't know where that somewhere will be. It will be somewhere only, not the place where you want to get to, right? So the first 33 is research, the second is strategy, and the third is tactics.
perfect. Perfect.
Thank you so much. One more, if you allow me, because we
Yeah, please.
discussed about multi-channel, omni-channel. So is it like what is the difference? I mean, I was thinking about it, and I do remember that we discussed on this topic a little. However, what is your take on that? I mean, would like to know that.
Okay. Now, again, these are English words, and let's interpret the meaning in English only. When you say multi, means more than one, and when you said omni, means it's not there, but it's still there. Like we say, God is omnipresent, right? So multi-channel is multiple channels which a consumer can access at multiple points in time.
Yeah.
You are at a doctor's clinic, channel 1. the doctor prescribes a product, you walk out of the doctor clinic, move to a retail pharmacy next door or in your own locality, that channel two, to get your prescriptions fulfilled. And then when you come home and read about it further, on that particular product or the brand that you bought, and that is where your channel 3 is, where the consumer interacts with the product and the product science and tech, independently, biased or unbiased, aided or unaided. That is channel 3. This is multi-channel, right? Omni-channel, I will give you a classical example, which we have all done. I'm 100% sure at least 90% would have done for sure. You stand in a multi-brand electronics showroom, flash an Amazon screen to the salesperson there saying that, "Dekh, mere ko idhar itna discount mila, tu kitna de raha hai?" That's omni-channel. That's number one. The second omni-channel is you are in an auto and you are paying the auto driver the channel of transport through a QR code, which is run by the payment gateway, where the money comes in from your bank, which is your own bank account, and the entire transaction happens at that one place. That's omni-channel. Now we have to discuss and decide whether pharma or healthcare is a multi-channel experience or an omni-channel experience. Think about it and then, approach what is it that you want to achieve, a great multi-channel experience or attempting an omni-channel experience or a great omni-channel experience overall. So that's how I would want everyone to look at it and evaluate. Nobody is perfect. Nobody is exactly one or the other. But everyone, every category, every product in a market with a consumer, with a customer segment or a channel will have to define its own process and journey and stay put to it. Hope that helps.
Thank you. Thank you so much. Thank you, Team Medgini.
Yeah, thank you so much. I think with that, we come to the end of the webinar, unless and until we have any questions which are coming in. Alok, hi Alok. Alok says marketing tools as multi-channel and omni is meant for sales. Yeah, so Vivek, the question which is coming in from Alok, or is this a statement? I don't know, but it's talking about marketing tools as multi-channel and omni is meant for sales. So do you agree to this? And yes, so coming back to what Vivek was telling in terms of health tech or pharma marketing, medtech, what is the approach as we marketeers need to take? It should be multi-channel or omni-channel. Please put in the chat in terms of what should you feel is the approach that you intend to take for your brand. Both are right, but it's about the experience that we intend to provide to our end customer. So what do you feel is the approach that you would like to take? Is it multi-channel or omni-channel? Yeah, you had a question, Purohit, Raj Purohit. Please go ahead. You may unmute.
Yeah, just one question, quick question for Ashish, you and Vivek.
Yeah.
As we all know that the dawn of AI has already taken upon, I think so the book would be also talking on the similar lines. But how, Vivek, in terms of into your day-to-day interactions, and soon the recommendation of product is coming through, would be through LLM models eventually. And this is where even the social media is directing towards. Do you see what is your sight in terms of what is coming ahead of us with respect to AI LLMs integrating into channel dynamics, hyper personalizations, all of these mass emails being very hyper personalized to the HCPs, content being very personalized? Do you see that thing? What is your insight on what is going to come ahead? That's my quick question.
Great. So I think AI is something which we have definitely seen across pharma marketing, various domains. It has been adopted, be it in terms of data analysis or predictive analysis. A lot of companies have started using this extensively for getting quick insights towards data. So data is being available in silos. We have done a session about two months back, and it gives a lot of perspective on how AI is being used in pharma marketing. And we have got an ebook also published, which we will love to share it to you. I think the two areas where we have seen companies are using it is one towards marketing, second is towards market research. So these people have got good results using this, including content generation, is something which we feel that AI is able to do justice to pharma marketeers. Vivek, anything that you have seen at your space, how AI is unfolding in terms of doing job better?
It's actually a very vast topic in itself, probably that requires another 1 hour of conversation. But long story short, if you look at it from the way I look at it is definitely, and I totally agree with Ashish, +1 on everything you said, Ashish. It's definitely helped a lot, or it's helping a lot in analysis, in interpretation. But definitely the decision making relies on, the human beings and not,
Human.
the intelligence per se. The intelligence of decision making should lie with you, should be done by you. And AI, or everything that AI provides, should be able to help you get there faster and get there with a much better, layout of the information that you would want. So it helps you with the entire structure. Now it all depends upon how the structure you only create within the AI, engine, but the decision making should be definitely with you, whether it is creative or otherwise.
Absolutely. Perfect. So I think with that, we come to an end of today's session. A lot of people have asked the LinkedIn profile of Vivek Desai. My team has put it in the chat. You can definitely connect with him. Based out of Mumbai, always available for people who require any help. Please feel free to reach out to us, reach out to Vivek as well. And with that, we come to the end of the session. And I thank all of you to be there with us today, and look forward to see you in person as well.
Thank you. Thank you, everyone.
Thank you
Thank
so
you, Ashish,
much.
for having me
Yeah.
here. Thank you so much.
Good
Take
day.
care.
Bye.
Bye.